Your liver could be filling with fat right now, tonight, while you feel completely fine. It would not send you a single warning. No pain. No ache. Nothing you could point to. And by the time most people notice that something is wrong, the trouble has been building quietly for years. I am Dr. Hale. I have spent 15 years in internal medicine, and if there is one organ that has fooled more of my patients than any other, it is this one. Smart people. Careful people. People who watch their weight and never miss a yearly checkup. They sat across from me stunned to learn that the largest organ inside them had been under strain the whole time, and it never once raised its voice. Here is why this should get your attention, even if you are in your 40s and you feel strong today. This is not a problem that politely waits for old age. Fatty liver often takes hold in the 40s and 50s, sometimes sooner, and it is far more common than people believe. According to the NIC, the liver and digestive branch of the National Institutes of Health, close to 1 in 4 American adults has some form of fatty liver disease. 1 in 4. And most of them have no idea it is happening. So in the next few minutes, I am going to walk you through 8 signs that your liver may be struggling, counting down from 8 to 1. The sign at number 3 is the one most people get completely backwards, and I will show you why. And the sign at number 1 is the one almost nobody connects to the liver, so stay with me to the end for that one. Let me start with the reason this organ hides so well, because once you understand it, everything else clicks into place. The liver has almost no pain nerves inside it. Picture a smoke detector with the battery quietly pulled out. The fire can be smoldering behind the walls, filling the house, and the alarm on the ceiling stays silent. That is your liver. It can be inflamed, it can be loading up with fat, it can even be starting to scar, and the organ itself feels nothing, because the tissue inside has no real way to send a pain signal. Only the thin covering around it can ache, and usually only once things are already far along. So your liver does not shout, it whispers. And it whispers through other parts of your body, which is exactly why these signs slip past so many people. Think of your liver as a factory that runs 3 shifts a day and never closes. It filters your blood. It packs away energy. It makes the proteins that let your blood clot. It handles your hormones, your cholesterol, and almost every medication you swallow. When fat starts crowding into that factory, the American Liver Foundation describes cells that become swollen and sluggish, and the whole operation slows down. You do not feel the slowdown directly. You feel the ripple effects. Those ripples are our 8 signs. Before the countdown, let me tell you who should lean in closest, because fatty liver is not random. It clusters with a few things that are extremely common in midlife. The NIDK links it tightly to extra weight around the middle, to type 2 diabetes and higher blood sugar, to high cholesterol and high triglycerides, and to high blood pressure. If 2 or 3 of those describe you, your odds go up, and they often travel as a package. Here is the part that catches people. You can be only mildly overweight, or even a normal weight on the scale, and still have fat quietly building inside the liver. So do not rule yourself out just because you are not heavy. This is one reason it slips past so many careful people. And when it does get caught, it is usually by accident. Mayo Clinic notes that fatty liver is often found when a routine blood test comes back with mildly elevated liver enzymes, or when an ultrasound done for some other reason happens to spot fat in the liver. No symptom sent the person in. A number on an unrelated test raised its hand. That is worth remembering, because it means the humble yearly blood panel is one of your best early warnings for an organ that will not warn you itself. Number 8 is a tiredness that sleep does not fix. Not the ordinary tired of a long week. A deep, flat fatigue that is there when you wake up and follows you through the day. This is the single most common thing people report. And it is also the easiest to blame on age, on stress, on a bad night. When your liver is overloaded, it is not clearing your blood as cleanly as it should, and your whole system runs a little heavier. If your energy has quietly drained over the last year, and no amount of coffee touches it, do not just write it off as getting older. Put it on the list. Number 7 is itchy skin with no rash to explain it. This one surprises people. You scratch your arms, your back, your legs, and there is nothing there. No dryness, no bug bite, no visible cause. When the liver cannot move certain substances out of the blood the way it should, they can build up under the skin and set off that maddening itch. It is often worse at night. On its own, it means little. Alongside the other signs on this list, it deserves a second look. Number 6 is dark urine that stays dark even when you are drinking enough water. We are not talking about the deep yellow of a dehydrated morning. We are talking about a tea-colored or cola-colored shade that does not clear after a couple of glasses of water. That color can come from a pigment called bilirubin, which a healthy liver normally processes and clears. When the liver falls behind, that pigment can spill into the urine and darken it. It is one of the more useful signs because it is easy to notice if you simply glance before you flush. Number 5 is bruising and bleeding that come too easily. A bump on the coffee table that turns into a bruise the size of a plum. Gums that bleed a little every time you brush. Cuts that take their time to stop. Remember that your liver runs the shift that makes your clotting factors, the tiny repair crew your blood sends to seal a leak. When the factory slows, that crew shows up short-handed, and you bruise and bleed more easily than you used to. If you keep finding fresh bruises and cannot remember earning them, pay attention. Number 4 is swelling in the ankles, the feet, or the belly. The liver makes a protein that helps keep fluid inside your blood vessels where it belongs. When the liver struggles, that protein runs low, and fluid can leak out and pool. It settles where gravity pulls it. In the ankles by the end of the day. In the belly, as a swollen, bloated fullness that does not match what you ate. Puffy ankles at night have many causes, and most are not the liver. But swelling that keeps returning is a conversation to have with your doctor, not something to ignore. Now number 3, and this is the one I told you most people get completely backwards. It is stubborn fat around the middle. Here is the mistake. People look at a thickening waist and see only a weight problem, a vanity problem, a few pounds to lose before summer. They do not see it as a liver signal. But belly fat and fatty liver travel together. The Cleveland Clinic points to extra weight around the abdomen and a large waist as a leading risk factor for fat building up inside the liver itself. So that spare tire is not just sitting on the outside, it very often reflects what is happening on the inside. That is why number 3 gets flipped in people's minds. They treat it as a mirror problem when it is often an organ problem. Let me pause here, because if these signs are landing and you want more plain talk about the things that quietly shape how you feel as the years add up, take 1 second and subscribe to Dr. Hale. And do me a favor. Tell me in the comments how old you are, because the ages of the people watching genuinely shape what I cover next. All right, 2 signs left, and number 1 is the one that catches almost everyone off guard. Number 2 is small clusters of tiny red veins on the skin, along with palms that look flushed and red. The little veins can look like a spider, a red center with thin threads spreading out from it, often on the chest, the neck, or the face. Doctors call them spider angiomas. They are tied to shifts in hormone handling that a struggling liver can no longer keep in balance, since the liver is the organ that clears excess estrogen from the blood. A single one means nothing. Several of them appearing together, especially with reddened palms, is a pattern worth showing a doctor. And number 1, the sign almost nobody connects to the liver. It is a foggy, slow, cloudy mind. Trouble finding a word that used to come easily. Losing your train of thought in the middle of a sentence. a dullness where sharpness used to be. People blame this on stress, on poor sleep, on ordinary aging, and they never once think of the liver. But when the liver cannot filter the blood well, certain substances, including one called ammonia, can drift up and reach the brain. Doctors have a name for the serious form of this, hepatic encephalopathy, and even milder cloudiness can trace back to a liver that is falling behind. That is why it sits at number 1. It looks exactly like getting older, and the real cause can be an organ that never sent a single pain signal. Let me tell you about a patient. I will call him Raymond, and he is a composite of many people I have seen. 51 years old, hard-working, a good eater by his own account, though he had a soda most afternoons and a couple of beers most nights. He came in mainly about the tiredness. Just worn down, he said. As we went through his story, the rest came out. The itching he scratched without thinking, the waistline that had crept up 2 belt notches, a mind that felt a half-step slow at work. Every one of those, alone, was easy to shrug off. Together, they were a pattern. And the pattern pointed straight at the organ nobody had looked at, his liver. Here is the hopeful part, and it is the reason I am telling you any of this. In its early stages, fatty liver is one of the most reversible conditions in all of medicine. The liver is a forgiving organ. Given a real chance, it can shed fat and repair itself in a way most organs cannot. The NIDK and the American Liver Foundation both point the same direction. Steady, gradual weight loss, less added sugar, more movement, and easing off alcohol can pull fat back out of the liver, especially when you catch it before it turns into deeper scarring. Think of the liver like a lawn. Cut it, walk on it, even damage a patch, and given water and time it grows back green. That is early fatty liver. But let the same patch get paved over year after year, and eventually the grass cannot return, because the ground underneath has turned hard. That paving over is scarring, and once it sets, it does not lift. That word, scarring, matters. Because that is the line you do not want to cross. Left alone for years, fatty liver can progress to inflammation, then to permanent scarring called cirrhosis, and in some people to liver cancer. Slowly. Quietly. Which is exactly why catching the whispers early is worth so much. Now let me be honest with you the way this channel promises. Not every tired, itchy, puffy day means your liver is failing. It usually does not. Every one of these signs has other, often harmless explanations. One sign by itself is rarely the story. What you are watching for is a cluster, several of these showing up together and sticking around. That pattern is your cue to act, not to panic. So here is what to do this week. 1. Ask your doctor for a simple liver panel at your next visit. It is a basic blood test, it is cheap, and it can flag trouble long before you feel a thing. 2. Cut the sugary drinks first. Soda, sweet tea, the flavored coffees. The sugar in them, especially the fructose, gets handled right in the liver, and it is one of the fastest ways to load fat where you do not want it. 3. Move your body most days. Even a brisk daily walk pulls fat out of the liver over time. 4. If you drink, give your liver some clear nights off each week. You do not have to overhaul your life this weekend. Start with the drinks and the walk, and let the forgiving organ do the rest. Now, one clear line before we finish. Everything I gave you today is education, not a diagnosis, and it is not a substitute for your own doctor. I do not know your history, your medications, or your labs, and some signs are not whispers at all. Yellowing of the skin or the whites of the eyes, vomiting blood or stools that look black and tarry, a belly that swells quickly, sudden confusion or a hard time staying awake. Those are not things to watch and wait on. Those get a call to a doctor or a trip to urgent care, some of them today. So bring what you learned here to your doctor. Ask for the liver panel. Mention the signs that felt familiar. Let a real person who knows your body tell you what it means, not the internet. And here is the thread I want to leave you with. I mentioned that one everyday drink loads fat into the liver faster than most people would ever guess, faster in some ways than alcohol, and millions of people pour it every single afternoon without a second thought. In my next video, I am going to name it, show you what it does inside the liver, and give you 2 easy swaps that take the pressure off. Subscribe so it lands in front of you when it goes up. Whether you are 45 or 75, your liver is one of the few organs that will genuinely repair itself if you give it the chance. You are never too early and rarely too late to start. I am Dr. Hale. Take care of yourself.